information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hi, everybody. Welcome to Ageless Health with yours truly. And we're going to get into the depths of why you're hurting. You know, it's like what pain's got to do with it. Well, that's going to be the topic of a program that we're going to be doing at the Roselle Center for Healing in Fairfax, Virginia, coming up April the 16th at 6 p.m. And you'll excuse me a little bit today because I have a lozenge in my mouth. Virginia has this wonderful allergy season that we're in the middle of right now. You know, now I understand my patients and how they can feel really good, but all of a sudden their voice goes. That happens occasionally. Don't know why. Got me this year, but it did get me this year. But I'm doing well otherwise. Don't understand. But let's get into the really topic of what we're talking about. It's called fibromyalgia. And, you know, you've heard me talk about it periodically. But it's a really important subject. And the reason it's important is that most physicians can't diagnose it. They don't understand what it is. It's kind of a catch-all. They rule everything out to say that this is fibromyalgia. And I want to give you some very salient, very succinct points of what fibromyalgia is and really what you can do about it. On the 16th at the Roselle Center for Healing, Dr. Stephanie P. and I are going to kind of be co-presenting. And we're going to get into it from not just this, but pain generally, about what really is going on in your body when pain just doesn't go away, why it's still there. Is it a manifestation of other things? Could it be something else that's causing the discomfort? And, you know, unfortunately, we go to our physicians and they're really well-meaning, but what they do is they start throwing medications at you. They start throwing drugs at you. We were talking about that earlier on WMML, is that you have to be very careful and that you don't continue to cause the loop to revisit. And having said that to you, I want you to really understand that fibromyalgia, or I affectionately call it the undisease, a paper that I wrote years ago, is really about identifying the process neurologically and to be able to stop it. So fibromyalgia, fibro means what? Fibrous connective tissue. It's not your joints. It's not the muscle per se. It's the fibrous network. And so here's where physicians get in trouble. Somebody comes in and you're legitimately hurting, right? The patient is in a lot of pain and they can't figure out where it's coming from. And sometimes they don't ask the right questions. They don't investigate properly. But at the end of the day, they say, well, it's not this, it's not that, it's not the other thing. So it must be fibromyalgia. Myalgia simply being muscle pain, but it's the fibrous connective tissue around the muscle that's really the problem. And, you know, interestingly enough, when you look at it, there's no inflammation that's associated with fibromyalgia. That's kind of weird, right? There's no inflammatory reaction. It's not the joint. It's not the movement of the joint. It's the pulling, the tugging, the aching of the muscular wrapper, the fibrous connective tissue. But what I want to do is I want to give you some really straight up, this is what you look for. This is how you rule it out. And then what we'll do is we'll put it together for you. So fibromyalgia, they can call it a syndrome. Fibromyalgia, is called a lot of different things. But here's the deal. Fibromyalgia has to be all four quadrants of the body. It has to be the upper two areas of your body, has to be the lower two areas of your body. It means your legs, your arms, and so forth. It has to be present minimally for 4 months. And it's widespread pain. It's all over your body. And again, if you look it up, they rule it in by excluding out so many other things. There's these tender points, these trigger areas, and you have to have at least 13 of them to be able to rule fibromyalgia in. If it's 7, you're still hurting, but it's not a fibromyalgia problem. So you begin to do the investigative work. Fibromyalgia is a chronic problem because why? It's been there for over 4 months and it doesn't stop. It doesn't go away. Because of that, it can produce fatigue. It can produce emotional upset. It affects the neurotransmitters. You know, all those guys that we talked about over time, that affects the direction of how your body begins to work. Neurotransmitters like what? Like dopamine, neurotransmitters like serotonin, and they go on and so forth. They all do different things, but now they're out of balance. They're not working. Some are suppressed and some are exacerbated. And we'll get into that very specifically on the 16th, and I'll show you what takes place. But more importantly, why it doesn't go away, why it's constantly there. And then we're going to show you how it can be fixed. That's the more important piece of it. So when you see signs of pain, you have to do your investigative work and try to figure out, why is that pain there? What is really causing the problem? So let's dive deep a little bit. Let's get into it just a little bit. So fibromyalgia, the symptoms, if you were associated with it, we talk about tremendous amount of pain or chronic pain, pain that is just kind of, you know, like a dog that's got a hold of your tail end and not letting go. And there's pain, but there's also fatigue. The fatigue is secondary to the condition. Muscle pain, tenderness. Yes, it's there. You can grab the muscle. You can, you know, push into the muscle, and it's painful. Sometimes the face and jaw are affected. Sometimes you have headaches along with it. Sometimes there's migraines with it. Sometimes there's digestive problems that go along with it, because all of these areas have a connective tissue that's being affected. Many researchers now are referring it to as a central cord pain pattern. Because why? Sometimes we see it from injury patterns, particularly in car accidents that traumatize the center focus of the spinal cord, causing irritation and infiltration of, if you will, fatty acids. Arachidonic acid is one of them, that doesn't allow the transmission from the brain to the rest of the body to work the way it's supposed to. So there's a lot of conjecture, if you will, saying this is really where it's coming from, and that there's this wind up process, which we're going to talk about next week, of what pain really is. So fibromyalgia symptoms are unfortunately used to diagnose the condition. Now, here's the deal. There are a lot of symptoms that are associated with fibromyalgia, but there's a lot of biochemical pieces that also represent in a very specific way. So let's dig a little deeply, right? We said that it has to be 4 months. It has to be that affects all four quadrants. It has to be something that, you know, it feels like the wrappers around the muscles and so forth are just compressing and pulling and burning and irritated, and there's pain. There's a central sensitization, sometimes called brain pain, that's associated with it. That's one of the reasons why they give the drugs that they're doing, the things that blunt your perception of pain at the brain. Some women will say that's just a tremendous amount of pain with intercourse, besides their body hurting. Migraines can kick in, but remember what I said, it's multidimensional. It's all at one time. When you look at the areas of trigger points, as they talk about, you have them right up into this area. You have them across the shoulder blades in the back. You have them at the low back. You have them on your hips on the inside. They can be right in through here in the elbow areas and so forth and so on. They can be lateral to your knees. So you start adding them up, and how many are there? Well, there's a whole lot of them that show up. There's actually 18 points that they evaluate, and you got to have about 13 of them for it to be problematic. So if you get in and you start looking at all the different, you know, thought processes, if you will, you begin to see that everybody has an opinion. And there's one guy that says there's 7 types of fibromyalgia pain. Well, maybe, or are we just characterizing the symptom process that has to do with this type of condition? My headspace, knowing what I know and I go through, said, well, yeah, just somebody's trying to stand out there and say that, the characteristic of the pain is what they're diagnosing, but they're still missing the point. Myofascial pain, again, the covering of the structure. That's one piece. When they talk about, remember I mentioned a few minutes ago, central sensitization pain, and it's that's another jump, a leap, if you will, and it has to do with the signaling components. And they give you, as what we talked about, the lyrica, the cymbalta, and the neurotin to kind of dumb down that expression. And they think that when that happens, they can do well. They're also using low dose naltrexone, which they're using for all kinds of things these days that has to do with pain. All of these guys have to have addictive patterns to it. Neuropathic pain. Neuropathic pain comes from when the nerve is being irritated, is being pinched, and they call it, by muscle compression and so forth. But the truth of it is, the nerve is being compressed at the origin, which is the spinal cord. It's being compressed by the malposition often of the spinal vertebrae. In my world, we call that a spinal subluxation. The osteopaths call it a spinal lesion. And you have to really understand that. So you have this neuropathic problem, simply says the nerves are being irritated. But the bottom line is, where does it come from? And there's this silliness called allodynia. And allodynia is the type of skin pain where it hurts to touch. But it shows up, and it can show up in the early, portions of fibromyalgia. But here's the deal. That allodynia is still treated the same way. It's treated by neurotin or lyrica and things like that, because they're signaling the brain to dumb down its perception of it. And then they'll get in things like Elavil and so forth, but then they go into headaches and so forth. But they're missing the boat. Fibromyalgia. You can have myofasciitis. You can have chronic pain patterns. You can have wind-up pain. You can have all kinds of things. But if it's not all four quadrants, if the trigger points aren't involved, if you don't have very specific characteristics, again, you have the fatigue pattern, which comes afterward. You have the depression pattern that comes afterwards. That's when it's affecting those neurotransmitters. That's when your serotonin drops down. That's when your dopamine drops down. Dopamine is that I want to go do something type of thing. And when you're hurting all the time and you have pain that just continues to express itself, it's something that's going to make all of you feel pretty lousy, right? So here's the deal. Most physicians are trained in putting the symptom out. They're not trained in identifying the underlying cause of the condition. You start treating somebody and they present with this, and they're on all these different medications that they were on even before they got the fibro pain. So what happens if somebody gets hurt? Well, you have a finger pointing that there was an injury, but now you have to find the pain cycle and where it's going from. If they didn't get hurt, why do they still have the pain? You have to look at the biomechanical, you have to look at the structural base, you have to look at the energetic platform, the acupuncture system, you have to look at how the mind is working. Do you know something? And this is something I want everybody to remember, that whatever you hold true about your health, whatever you say is going on, and you believe it, your body will own it. And then unfortunately, it gets to self-perpetuate the problem. So if that's the case, you got to be really careful what you decide that you're going to own. There's a lot of ways to modify pain. And when our practitioners are guys who are really brilliant at kind of, divining through this thing, and the patient comes in and they're on neurotin, they're on Ultram, they're on Flexeril, they're on Namenda, naltrexone and so forth. And then we go into the Lyrica, the Cymbalta and so forth. They have to look at several things. One, they got to find out where the pain pattern is coming from, but they also have to understand that these medications also can cause a wind-up problem that continues to perpetuate the problem. And we're going to talk about that next week a little bit and how we get into this wind-up pattern. But remember, with fibromyalgia, you're going to have fatigue, you're going to have depression, you're going to have the unwillingness to do anything, and they all come from different exacerbations and ongoing presence of that pain pattern. And we're going to get into that on the 16th. But would you know that if you can identify the trigger, if you can dumb down the constant loop that pain pattern's in, if you can heal and restore the irritation, the compression on the central nervous system, whether it's an injury to your head and the cranial bones shift, you got 22 of them, right? And it causes the spinal fluid not to move the way it's supposed to, whether it's a misalignment of the vertebrae due to an injury, car accident, or postural pattern. And how many of you sit like this all day long and you're on your cell phones constantly? Guess what you're doing? You're hurting that cord. And then patients will come in and tell me, it's really difficult when I stand up anymore. It's really difficult when I reach for something anymore. So I ask them questions like, tell me what you do during the day. Tell me what posture patterns you're in. Tell me how you sleep in bed at nighttime. Tell me what your workload looks like. And then all of a sudden you start putting this identificating pattern together, right? And I can see why people hurt. I can see why it doesn't go away. I can see why they start taking more and more pain medication. The beauty of it is if you begin to change the body's expression and the lifestyle that they're in while you're treating them, while you're bringing up the energetic, while you're making sure the spinal fluid motion is going, while you're making sure that the nerve roots are not irritated because of misalignment of the structural basis of the body, guess what you get? You get somebody that can heal. And that's what we're going to talk about on the 16th. So make sure you join us. Make sure you were there with us. Make sure that you pay attention, because when you come in, I'm going to show you things. Dr. Pina is going to show you things that are going to make a tremendous amount of sense. And you're going to say to yourself, why didn't somebody tell me that before? Why didn't I know that before? It's important that you understand your body's capacity to resolve itself. And we're going to show you little things that will help. We're going to show you how to modify the expression of that pain, how to get your body to re-engineer itself neurologically, meaning to start reporting the way it's supposed to. I think you're going to find that there's a resolution to this pain pattern. So join us on the 16th, 6 p.m. at the Roselle Center in Fairfax. And I really want to meet you. I want to help you through this process. I want to see if we can make a difference. Having said that, remember, we're here every week, and maybe we can start doing a little bit more of them. I don't know yet. It's in conversation. But I love you all. You have a great day. Talk to you soon. Bye.